you might have known somebody who had cancer, or seen someone who eventually passed on from cancer. But then, what happens to the rest of the family? What happens to family members? What happens to those who share similar genetic characteristics with this person that had cancer or just passed on? Right. So it's important that we understand the need for self-checks, for screening, as and when, and that we actually carry them out and proceed for follow-up check-up. Okay, so we are briefly going to talk about the screening modalities for two main cancers: breast cancer . Can you hear me? Okay. So we're going to talk about breast cancer and prostate cancer. Yeah, I'm sure we know that breast cancer happens in both males and females. Is anybody just hearing that for the first time? That men can get breast cancer? You're just hearing You're hearing for the first time? Oh wow, okay. So yeah, men can, because men also have breasts. It's just not as pronounced as women. Okay, so it's possible. It's just a very small percentage, less than 1%. Okay, so but despite that, we still have to screen. So we'll try to be gender neutral in the screening process that we are going to go through for breast cancer. Then I'll talk about prostate cancer, which women fortunately can't have because women don't have the prostate gland. Only men have prostate gland. Okay, so maybe the attention should be on Miss Teniola. Yeah, so she's going to just demonstrate what I'm going to be talking about. Now, the woman or the man that wants to screen, so say you stand in front of your bathroom, stand in front of your mirror, your hands on your waist. You can't hear me? Oh, you can't? Please. Can you all see her now? Okay. Okay, you can see her on the screen. Sorry, because of... Okay. Yeah, so you stand looking at the mirror, maybe after having your bath, then a situation that is comfortable for you. And first of all, you have to look at the breasts. Yeah, so most women, you agree that one is bigger than one. You get in your body, one eye is bigger than one nostril is bigger than one. Yeah, so same thing in the breast. So when you establish a baseline, a standard, you know what it looks like day by day. You know what to watch out for whenever you are checking the breast. So you check to make sure it's symmetrical, that there's no one is suddenly growing bigger than the other. Make sure there are no lumps on the surface of the skin of the breast. Make sure that the no lumps, no discolorations, maybe a reddish appearance on the surface, or like a puckering, what we call a puckering, like a folding of the skin, like a pinching of the skin. Okay, make sure that the nipples are normal. You get that they are not shooting out compared to the other one or going inside. That is inversion or eversion. Okay, make sure that the nipples are normal. So that's in looking. And then in looking, we want to visually divide the breast, each one, into about 4 compartments. Okay, so there's the upper inner, upper outer, lower inner, lower outer for both breasts, the right and the left breast. So you check, use the tip of your fingers and just gently press on each quadrant, the upper inner. You are checking for any lumps, any swellings. Now, at this point, I want to note that women who are still menstruating over the course of the menstrual cycle, you might notice some nodularities in the breast that usually resolve over time. So if you notice something like that, don't be worried. Just if it persists, then go to the nearest hospital. So using the tip of your fingers, upper inner, checking for any lumps, any areas of tenderness, any swelling, peppery sensation, whatever it may be. Then upper inner, upper outer. Then lower inner, lower outer, and around the nipple. Checking around the nipple and below the nipple. You also squeeze to try to check for any milk ejection. If there's any milk reflex coming out, including the men. Now this is for men. This is how you also check yourself. So for I'll mainly focus on the women because in the clinic, in the oncology clinic, if you take all the cancer cases that we see, half of them are breast cancer. About half of them, so it's very common. Okay, so the women is take note. All right. So we are upper inner, upper outer, lower inner, lower outer, below the nipple, and then in the armpits. It's very important. So you might not notice anything primarily in the armpits, and you might not, because the lymph nodes, what we call lymph nodes, lymphatic ducts, drain the breast, and they can carry cancer cells out from the breast into the armpits. So sometimes the first lump you might notice might be in the armpits. So check both armpits, right and left. So you do that process for one breast, repeat it for the second breast. If all is well, there is no change, there's no malformations, no abnormalities, then it's fine. So yeah, women, there are different guidelines for screening. Some people say once in 2 weeks, that's twice a month. Some people say once a week, depending on risk stratification. Men are not usually, it's not usually part of guidelines usually for men to screen, to check self-breast examination. I'm just saying this so you know what to look out for. You understand? So that's that. So whenever you notice a lump, so things that you might notice a lump on the breast itself or in the armpits. You might notice discoloration, you might notice the nipple inversion or inversion, you might notice pain. Any of those symptoms, please go to the nearest hospital and then further tests and investigations. So investigations, especially so when you notice a lump, some of the things you might look out for ladies 25 and below, we usually do an ultrasound scan because the breast tissue is still dense and some of the abnormalities might not be noticeable on a mammogram. But from 35 and above, you do a mammogram. So in the clinic, you'll be told how regularly you should based on risk stratification and all those things. But usually from 35 and above, mammogram, 25 and below, ultrasound scan. No need for blood tests for breast. That's that. So for the prostate, now, thank you so much. Yeah, it's awesome. Yeah, okay. So for prostate cancer of course in men, the prostate gland is an organ located just below the bladder, through which the urethra passes on. Am I using too many medical terms? Okay. Sorry. So from the bladder, when urine comes out, it comes from the kidneys down into the bladder, and then out to the urethra, outside. Yeah, so the prostate is just under the bladder and surrounding the outlets through which urine comes out. And the prostate's main function is adding to the ejaculate, like during intercourse. It's when the sperm cells are produced from the testis. The prostate adds the extra fluid to increase the possibility of moving sperm cells from where they are, into the female reproductive system where they can carry out their functions. So when cancer cells develop in the prostate, some of the symptoms that you might experience might be difficulty urinating, urinary symptoms basically. So, but we're talking about screening. So let's go there. The possibility of developing prostate cancer as a young person is slim, is minimal. I've never seen, I think the youngest person I've ever seen with prostate cancer was 39. And he had a very high risk, very aggressive disease. Like he had genetic predispositions and a lot of, so he was always going to be good. Most people come down from middle to late 40s, 50s with prostate cancer. So screening usually advocates that men start screening for prostate cancer from at least 40 years of age. It's a very common cancer among the male population. So the screening involves the PSA, checking the PSA level, prostate specific antigen. Who has never heard of PSA before? You have never heard. Okay. There's no shame. I'm not trying to shame you. If you've never heard, no problem. Like that's the point. That's why we are out here. Yeah. So thank you for being honest. It's simple. At least when you get today, you go and 40-year-olds around you that are males. You tell them to go and check. You know, some of my friends, I'm fortunate to be surrounded by people that are in their 40s and people that I can call my friends that I can talk about even medical things, and they listen to me. So some of them just go and check. There's a free health outreach. They go and check and they discover they have prostate cancer. Just like that, I found like 2 of them. So it's important that the men check. It's very important. PSA. So what we usually do to improve the possibility of remembering. You know, sometimes when I say, oh, I checked it, it was not last year, or was it 2 years ago, and you can't remember, and the thing is growing. If it's maybe part of the activities you do for your birthday, so you can have an annual reminder. Okay, on your birthday this year, you go out and you do your PSA. Then you have a way of following through. If you ever notice a rise, the normal PSA level is 0 to 4 nanograms per mil. If you notice anything higher than 4, there are other conditions, non-cancerous, that can cause a slight increase in PSA. So it's important to go to the hospital so that they can check and confirm and tell you, okay, you're fine, go and rest, or let's do some follow-up checks. So apart from the PSA screening, annually the doctor might want to do a prostate examination. That is going with a finger through the arm backwards to palpate the prostate gland. The prostate gland is usually soft to firm in texture. It has a medial soft. Okay, I don't need to explain all that, but it has an appearance that we expect when you palpate the prostate gland. So in cancer, and even in inflammation, infection of any kind, there are some changes that we expect that we see when you do a digital examination. So they can check that at least once a year is enough. They check if you notice any changes, then the PSA, they might request that test and then advise you accordingly. But it's important to do those, and then you might have to do an ultrasound scan depending on what they find. So that's it essentially. Annual PSA and visiting the physician to do a prostate checkup for the prostate cancer, and self-breast examination, and with or without mammograms for those 35 and above. Ultrasound for the 35 and below is not necessary unless there is maybe a lump that they want to characterize further. So I just want to summarize by saying first off that for the women, there are many things that can cause a breast lump. Many. There are benign causes, there are so plenty. Cancer is just one of them, but it's one of them that is very serious. So if you notice a lump when you are screening, don't be scared. Just go to the hospital, let them take it out. There are a couple of hospitals now that have a dedicated breast clinic. You can find out from the nearest facility around you. Then they'll take it out, they'll check if it's benign, fine. If it's not, they'll take it up from there. But the point of screening is to increase the possibility of early detection. To detect the case early, whether breast, prostate, whatever, treatments can be started early and survival, So with a small lump, if you take it out when it's still small, before it spreads, possibility of side effects, risk of metastasis, risk of other complications that can come up from the cancer itself or from its treatment will be reduced significantly. So early detection through regular screening is advisable. Thank you so much.